Hello everyone, Latanya here with Healthcare Corner Talk, and today I am actually going to bring to you an article review. Actually, my very good friend slash sister sent me this article. She is a registered nurse and just found it, very insightful and relevant, and said, "Hey, I think this would be a good topic to discuss on Healthcare Corner Talk." So I'm like, why not? I read it, I felt the same, and this is where we are now. So again, I just wanted to review and bring out some highlights, share those highlights with you. You will find the title that's listed here of the article, which is Pharmacist Patient Education is Needed for Caps on Out-of-Pocket Insulin. And the article is by Kristin Krauss, which was published January 22nd of this year. So, like I said, my friends shared the article with me, and the link did get broken, but I was able to locate it on Newsbreak because I'm subscribed to Newsbreak. So if you are, you definitely should find it there, or just do a general Google search of the title, and you may be able to find a website that publishes articles, and it's free, or if you have a subscription to a different type of platform with the news, and you may find it there too. So let's get right into it. So as Cross brought out in the article, diabetes is very costly to manage. I think this is common knowledge to everyone, especially those living with the disease. And in addition to the insulin, which has been a cost burden for persons living with diabetes in this country, there's other supplies needed, such as test strips, the Lantus, the glucometer, which is the blood sugar level testing device. Some people have the pumps, whether they need it or prefer it. And then there's the continuous glucose monitor or other medical equipment, depending on what you use across shares. So another thing I just wanted to mention, since we're on the subject of cost, diabetes is actually the second leading chronic disease in cost for healthcare expenditures. So it's very expensive, not only for people that suffers from the disease, but also for our government health plans such as Medicare and Medicaid, and obviously commercial insurances that cover services for diabetes. And then also, according to the American Diabetes Association, their 2021 statistics show that 13.6% of American Indian, Alaska Native adults were diagnosed with diabetes, while African Americans leading in second place with that at 12.1%, and then Hispanics at 11.7%. So these are our top three populations that is affected by it the most. Some, are more managed than others according to access and things of that nature. But it is a very costly and serious illness. And, they're trying to create ways to create better access. So as I continue on with this presentation, you'll see where I'm going with that. So the main, I feel like I should say after reading the article by Kristin, is that she wanted to show the new program that one of the pharmaceutical companies that manufactures insulin, which is Sanofi, they recently announced a $35 cap on out-of-pocket costs for Lantus, which is a type of insulin, and it's also one of Sanofi's most prescribed insulins in America. So in the article, she also mentioned other drug manufacturers such as Eli Lilly and Novo Nordisk that have some similar cost savings programs. And without a doubt, I think this is in reply or in compliance with the pharmaceutical the new Insulin Affordability and Inflation Reduction Act that came out last year, but tailored towards Medicare Part D and Part B, which in the next slide, I'll just give some specific details. So as of January 1st of last year, under the Inflation Reduction Act, out-of-pocket costs for insulin had been capped at $35 monthly, and that's for Part D. And then a similar cap took effect for Medicare Part B in July of last year. So again, they are trying to create provisions where, people are not being significantly charged for this life or death medication. So that's one step. And, just trying to control some of that pharmaceutical costs, which we all know about big pharma and being very expensive. So, in the article, Krauss shares an experience, or I should say, quote, an experience of someone who lives with type 1 diabetes. Her name is Mindy Salongo. And this is what she said. I think these steps are fantastic, but they're still steps. I had insurance that was not great, and the cost of my insulin and supplies was as much as my mortgage every month. And so I had to ration insulin for a year. Now Mindy is in a much better place with her new insurance, maintaining her cost to about $35 a month for her insulin. But just imagine what that may be for someone needing to ration their insulin or ration any type of medication to manage your disease. Like that is scary. And for people that don't understand what it means to ration, that means to like stretch it out. So you're, skipping doses to ensure that you have enough left over to cover you for a month. So you may not take it, as much as you are required or need to, just to stretch that medication for the month. And she did this for a whole year. So that's scary. And obviously that's a big issue. And I'm sure she is not alone in this. Her having type 1 diabetes is even more scary, because type 1 diabetes it's even more serious than type 2 diabetes. So I just can't imagine. And I'm glad that she is in a better place in her life right now. So Mindy had more to say, pointing out that there are some shortfalls of the savings programs. And here's some quotes from her. They're selecting which ones that will offer those prices. Not all insulins work the same for everyone. We still have a lot of boots on the ground and a lot of work to make sure that access to insulin is available to everyone. So pretty much that's exactly what the problem is: access. Selecting specific ones, so that's narrowing down what's allowed to be capped at $35 when there's other insulins that other people obviously take, because that's why they exist. But, they're still being charged, whatever that price is. And is it fair to say, because they can't take Lantus as opposed to another form of insulin? I'm not a clinician, so I don't, or pharmacist. So I don't know like all the different kinds of insulins, but just insulin, is that fair to say that, because they don't take the one that is capped, then they, are to be charged for the one that isn't? I don't think so, because their needs is their needs, and it's not their fault that their body does not take to Lantus. So obviously, there are some shortcomings with that. And then again, just reiterating what Mindy said, not all insulins work the same for everyone, which means they will need a different insulin besides Lantus. And that means those other insulins the cost needs to be assessed for those as well. And there needs to be a cost saving program in existence for those. So I know everything can't be done at once. And sometimes these policymakers, I can only imagine what they're thinking, like what more do they want from us? But you have a duty and you should honor it. And that's to serve the people in the best interest possible and not thinking about money and being greedy, because these are people's lives. So that's for starters. So Krauss also mentioned a pharmacist in the article that had some feedback, and I have what he said quoted here. You can have them already controlled, that is patients, on the medication, and all of a sudden it's not available. And this is said by pharmacist Otis Kirksey. He's the director of pharmacy services for Neighborhood Medical Center in Tallahassee, Florida. Another access problem, right? I can't speak from a pharmacist's point of view because I'm not a pharmacist, but just thinking that, the manufacturer, whatever the reason may be, stop making it, delayed in making it. I know COVID has caused some manufacturing issues for all markets, but, like he said, you have them controlled, and then all of a sudden this medication is discontinued. And now what? There may be another one that works, but it is not a part of the cost savings program. So now the patient is even more at distress because, for one, they can't get what they was getting that was working, and now there is something else that probably will work, but it's expensive. So, continuing on with Kirksey's thoughts, Krauss shares that Kirksey actually has been advocating for affordable insulin for years and helping uninsured diabetic patients by offering patient assistance. But there is an application process, and with lag time on top of a 3 to 4 weeks, duration period before even the medication is even available. So that is another, issue and a barrier to access and delaying that care that patient need that is a diabetic. 3 to 4 weeks is actually a long time, and depending on, which state they're in, that could be detrimental. So many issues, so many problems, so many concerns with this insulin situation. Kirksey does acknowledge that the caps on out-of-pocket insulin costs is a step in the right direction, but the education piece is also necessary, he says. Now, this is what I'm talking about. This is why I'm doing what I do, or I started doing what I'm doing. I've been working in healthcare for over 10 years within different disciplines, and over and over and over again, I just see so many things that's just clearly not thought through. And I feel like it's, especially when it comes to health literacy, there is a disparity there. So let's continue on to see what is Kirksey referring to in this instance of education, out-of-pocket costs, insulin. What is he talking about? What is he referring to? So Kirksey goes on further saying that each manufacturers have different criteria, and this is an issue because it can become confusing for patients. I'm going to pause there. Confusing for patients. And he even admits that it's confusing for him. So when he's referring to the manufacturers having different criteria, I'm pretty sure what he's trying to say is the qualifications for, being able to get this insulin at a discounted price. And, the insurer, the payer, they are involved in that as well. But of course, patients have a hard time navigating that. And then when we consider the population of people who are impacted by this disease, that may have limited education and reading abilities, low vision, or elderly persons, or just simply, they this old lingo, insurance lingo, and they don't understand this stuff. So, they need people to advocate for them, to support them. And unfortunately, that just doesn't happen for a lot of them. So Kirksey says, he foresees a challenge ahead. And this is what he says. I think the challenges that we're going to see is that people who really need it, they don't have access to it. They don't know about it. Again, another barrier to the access of healthcare, period, in America. But, staying on the topic of insulin and this $35 cap on insulin, it's like if they don't know, they're not going to be told, because the pharmacies and manufacturers, they want money, and it's your job to know your insurance and what your insurance is going to pay for. Now, even the providers that's prescribing, they're limited too on what they know, because things change all the time, especially with pharmacy benefits. And if they're not being educated or kept abreast on these changes, then they're just going with what usually works. This is what I've been doing for years. This is what I've been prescribing, and it correlates to your healthcare needs. So this is what we're going to do. But there are probably alternatives that can save the patient money. So I feel like knowing is always or not knowing is always a barrier. And Kirksey sees this as a challenge, and I agree. I think there will be, people just not knowing, especially with the $35 cap for our Medicare beneficiaries. They just won't know how to navigate the system, to understand what is it, and is this insulin available for my condition? Does it fit my needs? They will need someone to advocate for them, and it is a lot of work. It is. So definitely a challenge. And if they don't know, then they can't ask and they can't get it. So they're either rationing insulin or, paying ridiculously out of pocket costs when they could be saving money. And then another thing is that it all depends on the health payer's formulary. So whatever your insurance allows, that's what they're going to pay for. And I know pharmacy benefits is confusing. I mean, health insurance, medical stuff is already confusing, but pharmacy benefits is confusing. Tier 1, tier 2, brand drug, not like, it's just too much going on. So I totally get where this challenge people will face. So Krauss concludes the article with Kirksey saying, we do not, or we don't want anyone rationing insulin. And we don't. This isn't fair. It's not right. And I know I seen something, maybe it was last week, and it was definitely news to me. The founder of Insulin, I can't think of the name, who, if you're listening, you probably know, but I think he was when he discovered insulin and what it can do, he was like giving it out for free. Like it wasn't a cost for it at one time. And of course, the government or Big Pharma, whoever, I don't know who was involved in capitalizing on, the cost for it. But yeah, and like I said, it's the second leading cause of high costs in America, and also a lot of people, millions of people are diagnosed with diabetes. So yeah. And then here's some resource information. If you or someone you know need financial help with managing your diabetes, you can call the American Diabetes Association, ADA. The toll-free number is 1-800-342-2383. Their hours are Monday through Friday from 9 a.m. to 5 p.m. Eastern Standard Time. And then also, you're welcome to visit the website at diabetes.org. So with that, I hope that this video recording, presentation, etc., you found helpful, informative, educational, insightful, and also, allow you to take action. If you're someone who's living with diabetes, trying to better understand your health insurance, don't be afraid to ask questions. If you did not know about the $35 cap, well, now you do. So see if that's something that you can benefit from, whether, that is switching to insulin that will work for you, first off, and also affordable to you. And if you know anyone that is living with diabetes, maybe this can allow you to take action as well. But I'm here to educate, to enable. I feel like, knowledge is not power unless it's applied. So with that, I appreciate you listening and tuning in. And until next time, everyone, have a good day.